Hello, and welcome to Blue Tree Banter, a virtual panel where we get to sit down with some of the industry's top experts and get their take on what they're seeing across the nation. For today's panel, we're going to be homing in on the many impacts that coronavirus has had on community connect, mergers and acquisitions, and organizational growth landscape. I'm your host, Barrett Rohde from Blue Tree Network, and I'm excited to be joined today by two members of Blue Tree's executive partners team, Michael Esterl and Brian Reddig, and Lisa Johnson, who leads community technologies over at Providence. We will be discussing some of the trends that these three have been seeing in many organizations' growth planning spaces over the last few months and get their take on what they predict the future connect and healthcare landscape will look like. Lisa, Michael, and Brian, thank you all for joining me today. And I'd love to go ahead and just get started with some introductions. So maybe Lisa, I can have you kick us off.
Sure. Hi, everybody. I'm Lisa Johnson, and I have the pleasure of leading Community Technologies, which is Epic's or Providence's entity that extends Epic to community provider practices and hospitals that are in our regions to really improve the continuity of care. Been in this landscape quite a while now and also have a clinical background in women's and children's. I'm excited to talk to you today.
Wonderful. Excited to have you. Brian, I'll move on to you.
Hi, my name is Brian Reddig. I've been an executive partner at Blue Tree Network for the past 6 months, leading Expand Your Healthcare presence. Throughout my career, I've been focused on delivering growth and transformation through innovation in the healthcare industry. I'm excited to be here as well.
We're excited to have you. And finally, Michael.
Hello, this is Michael. I started with Epic, working for Epic in 2001, and then after 10 years and switched over to the customer side and helped lead large installs there, and then have been with Blue Tree for the past few years.
Wonderful. Well, thank you three for joining me. Let's go ahead and get right into the very first question here. So now that we're entering into this more virtual healthcare world where reaching your patients in more way than one is more important than ever, how are you all seeing healthcare systems' growth strategies or their portfolios evolve?
Yeah, so I can start. First and foremost, I guess I want to thank all of the essential workers for their heroic efforts responding to the pandemic. Uh, Health systems quickly went into their incident command responses earlier this year, focused on dealing with the COVID-19 threat, which brought projects that were not focused on the immediate healthcare crisis to a standstill. Unfortunately, the healthcare crisis also put financial strain on organizations as we saw elective procedures and patient visits being deferred. However, now that things are starting to reopen, organizations are planning for the new normal, or I've also, I guess, heard it called maybe more accurately described as the next normal. And through this, forecasting is still difficult as patient volumes and subsequent financial recovery varies across the country, and health systems are reevaluating their strategic portfolios and priorities. However, we have seen some key themes, and what I can kind of review what we're seeing from some of our partners, but they include a desire to enhance patient access through telehealth, making non-integrated solutions part of the electronic health record. We've seen interest in remote patient monitoring capabilities. That's largely through wearables or maybe a bio sticker. We've also seen partnerships with businesses in the community to provide testing and screening as we get back to reopening activities. And then we've seen some independent physician groups looking to become employed by health systems. So, that could potentially look like the mergers and acquisitions. There's been a desire to expand organizational reach through existing site infrastructure, leveraging an existing footprint by using some enhanced analytics and outreach. And then finally, there's the desire to get some of the community connect projects that were delayed due to the virus reinitiated and to go live. And Lisa can kind of talk through some of the benefits that host organizations really do provide to those connect sites through that partnership.
Perfect. Thanks, Brian. I think there's kind of two layers to this too. I'll speak to kind of the overall healthcare layer and what we're seeing across the board in the US, and then really about the Connect partnerships and the value that they've been able to play in this time. So when it comes to the pandemic, I think what we've seen is healthcare entities really zeroing in on how to really serve and support their communities. It takes a pandemic like this for them to really be able to have clarity around what's really important. So we're seeing a lot of that where they are re-looking at their priorities and making sure that they are honing in on the things that really matter. And then on the Connect space, I think this is where Connect partnerships can really shine. We've approached at Providence through community technologies more of a one in the family approach for COVID response. So our partners that we extend Epic to really were right there with us. So when we were starting to roll out different types of tools and technology to support COVID, we were supporting our partners the same way. They were at the table with us. So when we got tools at Providence, they got the same tools. And so really that better together mentality was there, and it made everybody stronger. And we saw that in a few different ways. One story was actually in Washington where we were able to really come together with our Connect partners to understand bed availability. So Washington was hit first with the first patient for COVID. And so we had to react really fast, and we were able to come together with other organizations that were on our Epic to really see what our bed availability was, what the capacity really looked like, and be able to report that to the state of Washington in a timely and accurate way, which was really the beauty of that Connect partnership and how that played out. So that can be a real strength, especially in today's world when we're all kind of in that same spot together, trying to react to things very quickly.
That's really fantastic. Thank you both for sharing that. And that's really great to hear that, setting that foundation with your Connect partners can really help you be nimble and flexible, especially in times like a pandemic that are completely unprecedented. Moving on then to the next question, the pandemic obviously has caused delayed projects, and we've also seen some projects accelerate, but can some of you talk through how you're seeing health systems reprioritize their strategic roadmaps? What's remained on their roadmaps and what has been added to address some more pressing issues?
Sure. I think one of the things we've seen is that everyone is reassessing capacity and trying to figure out what you could do with the staffing that you have and with the money that you have, both in 2020 and in 2021. We're seeing reprioritization of projects around projects that would bring in revenue, and then a focus on what you really need to do versus maybe what you wanted to do before. As far as Connect is concerned, we're seeing a lot of those projects. There was a pause, but we're seeing a lot of those projects continue forward. And one of the reasons that I think we're seeing that is, especially if you are a spoke part of that arrangement, you really want to be able to take advantage of what the hub has to offer, whether it's telehealth, whether it's MyChart and getting online scheduling, whether it's some other way to provide virtual care. So many of those projects are moving forward. Mergers and acquisitions seem to have taken a bit of a hold for right now. But overall, that's what we're seeing.
Great. Well, in the Connect space, I think I'll chime in and talk about what we're seeing both with Providence as a whole and also with our Connect partners. I do agree with Michael that they're really focusing on what is going to move the needle to serve patients in this time. And that means that some of that reprioritization has to happen because you've got to move fast and nimbly, which means that kind of putting money in different buckets maybe that wasn't as important prior to COVID. So patient engagement tools is number one, and televisits, and really making sure that those tools are front and center. I love the silver lining of this pandemic that folks are more open than ever on using some of those tools that maybe they haven't been before. Online scheduling, televisits, we've been really slow in this country to really utilize those to their full capacity. And now we're seeing more openness than ever to do that. And we're seeing a lot of successes in spaces that we didn't think we would before, even in geriatric patient populations, where they had noted that they feel like they see and had more interaction with their provider on televisit than they did when they were in the clinic itself. So I think that we're seeing anecdotal feedback like that. I think it's going to continue to really help us think outside the box and not be so afraid to do that, and really understand how to utilize those tools to the best of their ability. So that's one area. I think the other thing that we're seeing is that they're assessing their core competencies. So who and really what their strengths are, what they can offer their patients in their community, and then looking innovatively at partners or partnerships in the community where maybe they've got strengths where they don't, so that they can partner together to really serve their patients together in the community. So I think there's more openness to those innovative partnerships, and having those digital tools at a baseline like Epic Extension where you're already on the same platform really helps make those partnerships so much easier and more nimble, because you can start doing it right away because you already have those shared platforms. So I think we're seeing more openness than ever that way, and more creativity in that regard. I think the other thing is that folks expected that maybe there would be a delay where people would not want to go live or implement during this time of a pandemic. And we have seen mostly actually the other type of response, where we had a partner that initially asked to delay because their go live was in April, right when things really started in Washington of all things. And so we did delay for a little while just to get our feet under us and really understand what we were needing to react to from a pandemic perspective. But now they've decided to go live in September because they've realized, oh my goodness, if we have a surge in the fall, we really want those same tools that we can take advantage of because of the partnership through Community Technologies being an Epic Connect partner, that they will be better suited to actually respond to that if that occurs. And so they are going to go ahead and move on with their implementation. So I think that we're seeing more of that type of thought process instead of the latter, which is delay and maybe not moving forward.
Great. And Lisa, I think you kind of alluded to this before, and this is a perfect segue into our final question. Obviously, organizations now more than ever are really looking for ways to expand their services in order to better serve their patients. So what are some innovative ways that you're all seeing health systems across the country accomplish this? And are there any tools that are being leveraged now that weren't before? And I guess kind of the core question is, how do you pivot to go above and beyond?
Yeah, that's a big question. So there are a lot of different layers to that, I think. I think the first thing is what I alluded to before, which is really looking to make sure that they have strong digital platforms that are going to give them the tools to be able to respond in a more digital way. So things like doing online scheduling, patient engagement tools, televisits, those types of things. But I think there's also more to it than that. They need a strong partner, especially if they are a Connect hub or spoke, partner together to actually really make sure that they can respond to virtual bed units, all kinds of other types of things that need to be built, quick online assessments for tools. And so it goes beyond just kind of the regular virtual space that Epic offers, but also having a partner that can support the work that is needed so that you can be nimble and be able to do what you need to do in response to this pandemic for your patients. So it is a broad brush when it comes to technology, but also making sure that you have the right partner to be able to help serve and support you, that understands that you've got to respond the way that they do as another healthcare org. I also think that we're seeing differences in the space. So we have Connect partners across the US in different regions. And right now we're seeing a lot of need in places like Texas and places that maybe weren't as high need before. You know, I mentioned we started with Washington kind of being the first spot. And so this is not something that we've gotten past. This is something that different regions are still dealing with, and some of them are dealing with it now where we were dealing with it maybe a few months ago. So there's sort of like a wave that's happening where people are at different spots right now with their COVID situation and their numbers and their pandemic response. So we need to make sure that we don't let off the gas, essentially, and that we're there to help them, even if we're not maybe in that same response mode because of where we are in our regions. Some of our other partners are. So we need to be able to be there for them in that regard.
I think some areas to focus on as you look at partnerships going forward, reporting, which Lisa touched on, the ability to assess capacity over a much larger area is one of the things that when you have hospitals and sister hospitals working together, you can really do much better than you could previously.
Yeah, and I think just a couple of additional things to add. As we've alluded to earlier, different organizations are at different places in their recovery, and different organizations have different financial resources or the ability to expend those resources for how they want to grow. And so there are a couple of other opportunities that we've seen where it doesn't take significant resources to be able to look to still be able to try to grow, would be organizations leveraging their analytics for data submissions to ranking agencies based off of the great outcomes that they're already delivering. This strategy can be used for marketing and outreach purposes without having to build out a whole new site infrastructure or put up new buildings. Essentially, the healthcare organization could receive regional and national exposure to improve their market share through that new volume capture. And then another opportunity would be to analyze your disproportionate share volumes to see if your organization is eligible to participate in the 340B drug program to be able to reduce drug costs, allowing the covered entity to improve access to care. Because as we all know, unfortunately, the pandemic has led to some additional unemployment and maybe some additional uninsured folks. So leveraging that analytics capability to make sure that you're finding all of the areas of opportunity within your existing site infrastructure.
Brian, I'm glad you mentioned data analytics. To your point, there's so much that applies to that it can help. I think one thing that we hadn't touched on is COVID testing sites. So that's another thing that I'm seeing across the board with folks that have Connect partners in their communities. They're able to really see transparently where those COVID testing sites are. We were able to actually partner to figure out how we could accomplish enough COVID testing sites together instead of just within the one institution. And so again, looking outside of ourselves, making sure that we're partnering and utilizing those resources so that we can serve and support the community. So that's another way that data helped drive that, because we were sharing that data, we could tell that story and see where there was really a need with those COVID testing sites and then go from there.
That's really fantastic. I think to kind of sum us up, I know we're close to the end of our time here. I mean, some of the key themes I was hearing was being nimble, being a good partner, and really leveraging the tools that you have. I think a lot of organizations have these, and you may not know how to utilize it right now, but what better time than the middle of a pandemic? So if you would like to learn more about our Expand Your Healthcare Presence services, or get some help on figuring out how to better leverage those tools or how to be a better partner, you can feel free to reach out to Bluetree's client services team at clientservice@bluetreenetwork.com. I'd like to thank all of you for joining us today, and a special thank you to our panelists, Michael, Brian, and Lisa, for sharing your expertise with us. Really appreciate it.
Thank you, everybody.